All right, we are live. Episode 4, Sips and Tips. We're on a roll, man. 4 episodes in a row, pretty good, you know. I think they talk about podcasts. Most podcasts only put out 4 episodes before they fail. So super stoked that we're at episode 4. We'll see people roll in here. I do have a couple good questions today. So a couple ways you guys can post your questions for me. You can comment them here if you have any questions. You can send them to me beforehand through DM or comment on some of our posts talking about tips and tips. And then hopefully one day I'll get someone to actually come on and join the live chat and ask me the question in person, get you on the show. That is my ultimate goal. I love the idea of a call-in show or a video chat show. So if you have a question and you're in this live chat and you want to show your face, request to join and ask your question. That would be really fun. I do have some that I'm going to get to here shortly, but fun little story. Obviously, Sips and Tips, big coffee fan. If you guys don't know, we have a podcast called the PT Coffee Cast that my business partner and I started, when we were in physio school. And the reason we started it was because we drink a lot of coffee and we'd rant about physio stuff. So we launched this podcast, and we actually at one point in time were a coffee brand. We had our own coffee. I wish I still had a bag. I think Will does. It was called the OG Blend. It was probably the most fun I ever had, making something, creating it. We sent out bags. We sold it for a period of time. I really do miss that. So if there's anyone that's watching this show that's in the coffee game, maybe we should get back into having some coffee, our own branded coffee. That would be fun. But thanks, guys, for tuning in. I'm going to dive into some of the questions right now. So the one off the top that's fun to get started is from a friend of ours, Alex. He asked gym short recommendations. Now, I'm still on a mission to find a good gym short. I am a Lulu fanboy through and through. I'm literally wearing Lulu pants, a Lulu shirt right now. So I have a lot of Lulu shorts. The 2 shorts that I wear a lot are the Surge short and the, which I don't know if they even make that anymore, and the Fast and Free short, more for running. In terms of training, I know their License to Train short is pretty good. The one thing that I'm still not sure of what I like more is liner built in or liner not built in. Some shorts have a good built-in liner, some do not. But those are the 2 shorts that I wear a lot. I haven't tried a ton of different brands, so I wish I could offer you more insight into a good short recommendation outside of Lululemon. If anyone in the chat knows, what's up, Nathan? If anyone in the chat has some suggestions on gym shorts that they like, throw them in there. I've been wanting to try Gymshark as well. I've heard they got okay products, but yeah, Lulu guy through and through. License to Train, I heard is a good short. Never worn it. What is it? The Run Free, Fast and Free, and then the Surge short. So good question. Another question that he had, which is a little bit more relevant to some health, is what are some of the personal health markers that you keep track of? So for me, I wear Whoop, so I track a lot of that data. The things that I really try to keep an eye on, honestly, from a day-to-day basis or a week-to-week basis, is where's my HRV at? Where is my sleep at? Those are probably 2 big things. Most of the time when I see my HRV trending way down and then I see my sleep trending way down, it's usually a sign that I probably need to, one, prioritize sleep and recovery, and maybe look at what is my training looking like. Am I pushing super hard here and putting myself in the red, which is what Whoop shows you when you don't have a great recovery score. I would say those are the 2 things that I pay the most attention to when it comes to objective data. I've not been getting good sleep lately. I've been getting up a lot earlier, trying to get to bed at the same time, but getting up at 4:30, 4:45. So I'm only getting about 6.5 hours of sleep, which isn't enough right now. I need to get that up. I find 7 is the bare minimum. And then when I'm training, I need to be getting 8 to 9 hours of sleep, which doesn't usually happen. But those are the 2 objective measures. I talked about this on the first episode of Sips and Tips. What I also look at is subjectively is how I'm feeling. I try to rate, where's my level of energy? Where is my level of feeling recovered before I look at my Whoop? Because sometimes looking at that objective data can really throw you off. But I would say those are the 2 main things that I'm looking at. I wish I had better insight into some like blood markers. Like I don't really get my blood tested. So if anyone has like any suggestions on how you can do that in Canada effectively to get some good testing, I would love to hear, because I probably should look at that and see where some of those biomarkers are at. But yeah, those are the two things that I look at. Nathan asked a question: do you think it's necessary to have a heart rate monitor to track those, or is a wrist-based heart rate monitor like Garmin Watch sufficient? I've heard mixed things. Yeah, I think the best way to get the most accurate heart rate data would be to wear a chest strap. I don't really know about like tracking your heart rate throughout the day. Like I know Garmin has a lot of HRV built-in technology now that tracks from the wrist. I wouldn't wear a heart monitor around all day just to track like my base level heart rate. But if I'm training and I want to get the most accurate heart rate data, for example, like doing marathon prep, I'm probably just going to wear a chest strap just because from my understanding, it's the most accurate. I know Coros, which I'm a big fan of Coros, has their arm strap. I'm probably going to switch to the arm strap purely based on comfort. I find like the chest strap, whenever I'm like really sweaty, just like falls down and it's super annoying. So I'm probably going to go to the arm strap. I don't really know the difference between like the bicep strap and the chest strap on terms of the research as what's more accurate. But I would say like a chest or arm strap is probably going to be more accurate than the wrist. One thing I always tell people though is like, if you don't have those options, it's all good. Just make sure you're tracking on the same device. Like if you're always tracking from your wrist on every workout, every run, day to day, like that data can just be compared over time. So just comparing your own data to your own data on the same device, I think is probably the best way to go about it. But yeah, that's a good question. Sticking on the running topic, I tend to get a lot of questions around running. This is from my good friend Will. Shout out to Will. He asked, cross training for running, are some options superior to others? Yeah, this is a good question. Honestly, I don't do a ton of cross training when I'm in my marathon preps personally. Like majority of the time, I'm just running. In terms of like another aerobic cross training activity, cross training to me also includes strength training, so that's always something that I keep in. Usually in my marathon preps, early on I'm training 3 times a week, and then as we get close to the marathon, down to 2, and then usually like a couple weeks before, depending on how fatigued I am, I'll just pull it out all together. But I think you should always be strength training, so that's definitely one cross training thing you should keep in. In terms of like biking versus elliptical versus a rower, I would say, probably most common is the bike or the elliptical. I think a lot of people that do cross training for more aerobic gains, which I've seen some people that I follow who do this, like the elliptical, because it kind of mimics running the most accurate compared to, a bike. But honestly, I don't think it really matters. I think what's most important that is if you're getting some cross training for some more aerobic gains outside of running, is just that you're watching what your heart rate is doing. Like I think it's harder sometimes to get into zone 2 heart rate on the bike. At least I find that on like a stationary bike. I've never really used an elliptical, but I would say those are probably the 2 most frequent options that I've seen used. In terms of what's more superior, I honestly don't really know the data on that, and I don't really have too much personal experience, but maybe someone in the chat has used some other cross-training modalities such as like a bike, a rower, or an elliptical, and they could add into that. But strength training, always a necessary cross-training thing to keep into your program 100%. Other question that I got was from a friend of mine who's been dealing with tibialis posterior injury. For those of you who don't know what that is, it's like the tendon that runs down the inside of your calf, kind of wraps around that bone on the inside of your foot. A lot of runners deal with tib post injuries, tendinopathies. In this case, I know this individual has had a pretty substantial injury, having torn their post-tib tendon, and have incredibly flat feet. So definitely a little bit more of a severe injury. I just posted a clip about this the other day. that exercises are exercises, and the important thing is that it's in the context of the person that you're working with. So whenever I'm kind of talking about just general advice, it's kind of hard because, what this individual does is very high level and takes a lot of load requirements. So probably going to look a little different than someone who maybe is running once or twice a week just for fun. But with all that being said, I think when it comes to like rehabbing like the tib post tendon, I'm usually obviously looking at how do we build up the tendon itself. So there's different exercises that we can focus on that will build that up. A lot of it has to do with like inverting the foot or turning that in. We can usually start with band work as a nice entry point. And then I'm a big fan of building up the calf in its entirety. So calf raises in different positions, so we can kind of bias different tendons by changing the positions of our feet. So we could have toes forward, toe out, toe in. So loading all three of those positions is usually a go-to of mine. I'll usually work a lot of like arch strengthening, especially for someone who does have like flat feet, like this individual said. The more we can focus on trying to load the arch and build the arch up strong will hopefully help that when they're running and kind of transitioning from their heel to toe to have like a little bit more of like a solid arch there. So we'll do a lot of, toe exercises with like towel scrunches, and even like, maybe doing like some picking up of marbles and moving them, like those little things. They're kind of small exercises, but really good at loading the bottom of the feet. And then I would really try to build some resilience in this tendon. So oftentimes I find when it comes to like calf loading for runners, they really underdose themselves. Like they do body weight, or they do like 10 pounds. And when we look at the forces that go through the calf and the Achilles in running, it's like a crazy amount. So we really need to load this up heavier. So I would actually probably have this individual working in a very heavy rep range for calf raises. So, we're looking at more like 6 to 8 or 8 to 10 reps at like very high weight for that individual, so that we can really adapt the resilience of that tendon, especially something that was torn. We want to build and make that muscle and that tendon a lot stronger. So overloading that, some heavier, slow resistance training is really good. And then the last thing that I would really make sure I would do with this individual, and I think is a missing link in a lot of tendon rehab, is especially for higher level athletes, like for most people, but for this individual, is some plyometric work and some power work. Like all running is plyometric hopping from one foot to the next for 5, 10, 15, 20, half marathon, marathon. But yet we don't train this in our programs. So I would really make sure we're doing a lot of, double leg pogo hopping, single leg pogo hopping forward, pogo hopping backward, side to side pogo hops. Even just working on some power based stuff under load, like squat jumps or box jumps under load, or anything where this individual really needs to generate a lot of force through their tendon, because we know how important that is. So I think a big issue that ends up happening with these athletes and most people who are trying to transition back to running with a tendon related issue is they underdose it, and then they don't actually expose themselves to plyometric based loading enough, and they transition back to running, and then that's the most amount of plyometric load that you're going to get under a lot of force, and they flare themselves up. So if you're looking to bridge that gap back to running and you have a tendon related issue, you really need to make sure that you're loading it heavy and building up some resilience in the tendon first. And then we're going to move into that plyometric phase of rehab where we're getting higher velocity, reciprocal loading patterns that mimic the sport of running, so you can build up the tendon to that load to tolerate it. So I know it's not super specific, but that's kind of how I look at it. You know who you are who asked this question. If you need my help, you know that I will help you. I would love to give you some guidance on this more specifically, because I think I could really, really help you get back to crushing it out there. So reach out to me. Wellness by Flea, what's up? Happy to see you here. Thanks for joining. But in terms of other questions that we have, if you guys have any, you can ask it now in the chat. I think I just saw one come in here. Ask away. The more questions, the better it is. Sorry, my Instagram limit came up, which is bad. It's only like 9 o'clock and I'm already over my limit. Do you have any opinions on wearing stability shoes versus neutral shoes? Is it necessary that people with extra pronation be placed in stability shoes, or should it mostly just be comfort and load management? This is a good question. I think I'm not a shoe expert by any means. I definitely have learned a thing or two about shoes just having run a ton. It's very, very easy to become consumed by shoes and buy them all. Throughout my marathon prep, I definitely did this. I even made a whole YouTube video on my YouTube channel about the shoes that I love running in. But I do think this matters depending on the individual. So the most important thing from my understanding and what a lot of the research will support is that finding a shoe that is comfortable for your foot is number one. I think a lot of people try to force themselves into shoes based off of like their quote unquote anatomy or what they've been told by like a gait scan that aren't comfortable. And now you're running in uncomfortable shoes thinking, okay, I know this is uncomfortable, but this is the right shoe for me. So I'm just going to keep pushing through this until it becomes comfortable. I don't think that's the right approach. I think you need to consider some of those factors in terms of like your anatomy and the gait analysis and whatnot. But like ideally you're trying to find the most comfortable shoe. And then once you find the style of shoe, whether that be a stability shoe, a neutral shoe, then you want to get multiple pairs of shoes that feel really good, that are that kind of shoe, and you want to rotate them. So making sure that you're rotating your shoes throughout your running is really good. Even if you're rotating the exact same shoe. Like if you have two of the same shoes and you're just rotating it because you like them, that's a great way to, one, make sure you're not wearing out your shoes too fast, two, to change the loads, because you're going to wear those shoes differently, which is going to change the way it loads your foot slightly, which is really going to help you out if you're building for longer volumes, such as like a half marathon, marathon. I think where a lot of this stuff ends up mattering more is if there's an injury that is present. So we want to make sure that like if there is injury that's present, that we can bias like a shoe that might help better than others. So yes, if someone's having a ton of pain, maybe they're very flat-footed, they're overpronating, and we want to try to see if we implement a more stable shoe to help them not overload that tissue for a period of time. That's definitely something that I would consider doing because we just want to make sure that we're trying to calm those things down. But I think a lot of people fall into the trap of forcing themselves into a shoe that is told to be the right shoe for them based off their anatomy, and then it ends up being super uncomfortable and they just run in an uncomfortable shoe. So yeah, that's my opinion on shoes. Again, I'm not a shoe expert, but those are kind of some of the things that I would I would consider. Another question that I got is, and we're really on the running theme a lot, is like, if I have, knee pain when running, what are some things that, I should consider? This is obviously a very general, question, but if I'm working with someone who does have some knee pain when they're running and we're trying to keep them running and doing their training, you really want to consider the terrain that you're running on. So one thing that we know is like when we're going downhill, it's going to tend to load the knee a little bit more. So I would really consider avoiding too much elevation. I find that that's going to be a little bit easier on the knee. This is usually super important for people who are doing a lot of trail running where there is a ton of elevation. We might say, hey, let's limit that, or let's have you run on the road, which I know trail runners don't like that so much, but changing the terrain and the loading to the knee is really going to help that calm down. Even changing cadence can help. So I find oftentimes by having them change that, like running on a metronome, which you can get just by like looking on Spotify, actually just helps change their cadence, which changes the way that they load their knee. So those are two things that I look at, from knee discomfort. And then oftentimes even considering implementing some run walk intervals depending on how flared up the individual is and like what the rehab process is looking like. I think we really tend to demonize walking when running. I know like I have that mindset too, but when it comes to like being able to continue to train and be productive with training, as well as help rehab an injury. Implementing something like a run walk, where one, you're reducing the load by not running the whole time. Two, you're giving your body some time to like process what the load is doing to the tissue. With having that little walk break, you can evaluate, okay, how is my knee pain feeling? You can reflect on it. It can help you make decision-making processes moving forward as like, do I want to continue this run? Or maybe this pain is getting into an unmanageable level and I need to pull it back. So I think really implementing some run walks is another great way for us to manage some discomfort. Let's see here. Yeah, if you guys have any more questions that are on the top of your mind, feel free to fire them in the comments. For those of you guys who are just joining, welcome. Thoughts on running with no ACL? Yeah, I think that there's a lot of positive research coming out on conservative management of ACL tears, and that not necessarily going right into surgery needs to be the first option. Now, this is like very context dependent. It's going to depend on training history, health, sport that you're returning to, all those things. But I would really consider, like, if someone, like, I know your situation, Flea, having talked to you before. You've had this going on for a long period of time. You're strong. I watch what you do on your Instagram in terms of like your strength, your power. You're actually even doing some lateral cutting and change of direction stuff with tennis. I would see no issue in you running without an ACL, especially running being a very linear sport. Obviously if we get into the trails, it's going to change it up a little bit, but oftentimes, like, getting people back to something like running post ACL tear that hasn't gotten surgery is definitely something that we can do. I've done this with a few of my past clients. You can even get back to doing things like cutting-based sports. It's just going to really depend on who you are, where your strength is at. I think one determining factor is getting the appropriate return to sport testing. I find there's a bit of a gap in appropriately testing people to return to sport post ACL tear, both both conservative and reconstruction. I think as a profession, we could do a better job of making sure that these standards are high, because there is a lot of strength and testing that needs to be done, a lot of like jump testing that needs to be done. And I think a lot of times people don't get the appropriate objective testing, and then they're kind of stuck in the zone of like, I feel stronger, I think I'm stronger, but I don't know if I'm stronger, and they don't actually get the appropriate like guidance to like return to sport, and then they jump back into it way too soon. And this is why we do see a lot of higher re-tear rates. So I really think that is the most important. Make sure you're finding a physio or a healthcare professional that takes you through the full battery of return to sport testing. At the movement, we use the Melbourne ACL guideline or a protocol, which is like a super awesome protocol. It's criterion based versus like time based. So a lot of these ACL protocols will go based off time. So like when you hit 8 weeks, you will do this. When it comes to the Melbourne protocol, it is more criterion based. So once you're checking off the criteria at each stage, we're able to move through the next stage, which really makes it a lot more individual to the client. But like when we're at that end stage transitioning back to sport, we're looking at quad and hamstring force gauge testing to look at quad hamstring ratio. We're looking at quad strength from injured side to non-injured side. We're looking at triple hop test, single leg hop test, lateral line hop test. We have people do like a kinesiophobia kind of like, what's the word I'm looking for, survey to see like how much fear is there. So there's so much important stuff to make sure that you're checking off the list before you go back to sport. I see Amanda here is also a member of the No ACL Club. Amanda, are you running? Like, what are you doing? I think there's a lot of people that can perform at a high level without an ACL, and I think it's very much something that we can do more and more now. And if I'm thinking about myself and I had that injury, I would very much be considering conservative care depending on my circumstances before just rushing into surgery. Not that surgery is bad, but I just think that like we get rushed into surgery in the medical system a lot quicker than maybe we should, and just like taking some time to think about like what actually results in having a surgery. Like, what does that look like post? How long am I going to be out? What's the repercussions of how weak I'm going to become in comparison to like, can I actually be getting stronger and getting my range of motion back and actually doing a lot more right now post ACL tear than like waiting, till you get the surgery and then having to go through that process again. So I really encourage people to meet with a physio that can guide you through that process so you can help them, so you can get help with that decision-making process. Flee, tons of fear. Yeah, totally. Like that makes sense. And like the interesting, I know you recently just got this confirmed by MRI. I would imagine you thought that it was torn, but like now that you know that it's torn, I wonder how that's impacted you as well. But yeah, I think doing some return to sport testing would be really good for you, because what I could see being positive is if we're getting your objective numbers and we're checking all of those boxes off the chart, that's something where it's like, hey, objectively you're strong here. Psychologically there's fear, which is totally normal. But if I'm objectively checking all these boxes off, we can work on improving, the fear by like gradually exposing you to some of those things that you're nervous about, improving to your body that you can do those things. Because if I was like checking all those boxes off, I would really be highly considering just continuing to do conservative approach if it was me, just because you can always go get a surgery. That's the one thing, especially if it's not impacting your life where you can't do the things that you really want to do, which I know you're doing a lot of things that you want to be doing. So yeah, I would love to chat more about that. I'll definitely reach out. Nathan, super useful information. We start lower body MSK in 2 weeks, so this is a nice little preview for some of the treatment principles. Yeah, Nathan, feel free to reach out if you want a little bit more info on like anything but like ACL rehab. I'll connect you with our guy Nick. Nick is the ACL dude at the movement. He knows way more than me on the topic. He sees ACL athletes. He was actually in this call not too long ago. I think he probably left by now, but I will connect you with Nick and he can give you some insights into some of the things he considers. If you guys are dealing with any issues from an ACL standpoint and you're local to Hamilton, Brantford, reach out. I'll connect you with Nick because he's the man. If anyone else has a question, put it in now. If not, Nick is still there. He can tell me if I was completely talking a lot of smack that wasn't good, or if he has anything he wants to add to the conversation, but hopefully he gives me the nod of approval on some of my thoughts there. But honestly, if you guys are in this chat and you have ACL questions, literally DM Nick. He knows what's up. Any other questions before we wrap up here? We'll have you put them there. If you guys want to see the replay of this, we put all of the episodes out on our YouTube channel. We're really trying to build our YouTube channel up this year, so if you guys are fans of YouTube and you want to see some fun content, head over there. Subscribe to the Movement YouTube channel. You can find it in our bio on Instagram. You can just search like the Movement PTs on YouTube. We put out a ton of fun content. We just dropped a video of Will, his second episode of building up for the Sulphur Springs Ultra Marathon, so we're documenting that. We have some stuff going out around the bay. We have some low back pain stuff on there. We have a ton of cool videos. Head over there, follow it. You can watch tips and tips. If you have any questions, feel free to send me a DM throughout the week. You can comment on some of the posts that I put out about tips and tips. I'm having a lot of fun doing this. Number 4 in the books. We will be back next Thursday, 9 a.m. Sips and tips. Get your questions ready. Get your coffee ready. And maybe by the end of this series, as it starts to get a little more popular, we'll have another coffee brand. Shout out to the OG coffee blend in the PT Coffee Cast. But that's all I got for today, guys. Thanks so much for tuning in. Really